Hi there, this is MD Musaddek Hassan from Food Engineering and Technology Department, Shahjahan University of Science and Technology, Sylhet, Bangladesh. My research title is Antibiotic Resistance in Gram-positive and Gram-negative bacteria isolated from street-vended foods and fresh vegetables in Sylhet city. We all know that bacteria are single-cell organisms and disease-causing bacteria trigger illness. So antibiotics are drugs for fighting infections caused by bacteria. They reduce illness, even death from infectious diseases. However, antibiotics have more beneficial effect. Their overuse has contributed to the problem of antibiotic resistance. Some bacteria give the antibiotic resistance to other bacteria, causing more problem. So, in our second picture, this is how antibiotic resistance reaches from farm to table. We can see that all animals carry bacteria in their intestines, and antibiotics are given to the animals. Most of the antibiotics kill most bacteria, but resistance bacteria survive and multiply. Then resistance bacteria can spread by animal products and other products in our body, and people can get sick, resistance infection from contaminated food and contaminated environment. Then the impact that some patient infection cause mild illness and severe illness and may lead to death. So our research objectives are isolate gram-positive and gram-negative bacteria from street-vended foods and fresh vegetables. Then examine the antibiotic susceptibility of the isolates and microbial risk assessment. So we isolate some gram-positive and gram-negative bacteria from street-vended foods and vegetables, then identify them by morphological and biochemical identification and Gram staining technique. Then examine the antibiotic susceptibility of the isolates by Dick's division method by zone diameter inhibition diameter. Then we can see that many bacteria, they are resistant to multidrug resistant and some bacteria are susceptible. So as a result, we can see that among E. coli, Klebsiella, and Staphylococcus aureus, almost all of them exhibit multidrug resistance. And all isolates were 100% sensitive to aztreonam and ceftriaxone. About 100% of E. coli and Klebsiella was resistant to ceftriaxone and oxacillin. And besides, 100% of Staphylococcus aureus was resistant to oxacillin. Dr. Tom Frieden said that if we use antibiotics when not needed, we may not have them when they are most needed. So our study raises concern about the safety of street-vended foods and warns about the lesser known transmission of resistance bacteria to humans. For our future work, emphasis will be given on isolate more bacteria strains from street-vended foods, vegetables to study antibiotic resistance pattern and associated virulence genes. Thank you.